Now, as you look at the MVP program, why would a MIPS participant, or why should a MIPS participant consider using an MVP before they're required?
MVPs work really well for lots of practices and providers. For one reason, you only have to report on 4 quality measures as opposed to 6 under traditional MIPS. If you're a practice that struggles with measure selection or has a really challenging time accessing your data, if it takes a lot of manual intervention, doing it on 4 measures is going to be easier than doing it on 6. The other factor for MVPs that are really beneficial to practices is it's a great way to limit your exposure to the cost category. When you select an MVP to report, you know which cost measures could apply to you. So instead of having the full range of cost measures that may apply to you for a variety of reasons, maybe you feel a little overwhelmed or like you can't control that, through an MVP, you know exactly what cost measures could apply to you and can really focus on those areas, make sure that you are paying attention to those patients and impacting that cost score. Another great thing about MVPs is that for the improvement activities, you only have to report 1 improvement activity as opposed to traditional MIPS where you would have 2. And in the PI category, if you have the promoting interoperability category reweighted anyway, maybe you're a small practice or have some other special status, that still applies in MVP. There's no additional burden put in place by reporting MVP. So primarily the reason folks should consider an MVP is it really can make your reporting significantly easier. And it is a great way to reduce some of the burden and risk that practices can experience in the traditional MIPS program.